This is what a 17-year-old with a known peanut allergy looked like when he came into the ER, despite having an EpiPen. He didn't use it because he was afraid of injecting himself. Anaphylaxis moves fast, and I'm going to tell you about some of the most common mistakes that I see in the ER and how to save a life. Anaphylaxis is a severe allergic reaction where your immune system goes into overdrive. It happens when your body misidentifies certain triggers or antigens as a threat. And sometimes these antigens are from food like peanuts, bee venom, medications, but the list goes on. The mast cells of the immune system then release their contents of pro-inflammatory molecules, which trigger an allergic reaction. And sometimes there's a massive release throughout your entire body. So if it affects two or more of your organ systems, like a rash on your skin or facial swelling, lungs with wheezing and shortness of breath, your cardiovascular system with low blood pressure or dizziness, or your GI system with nausea or vomiting, that is called anaphylaxis. In severe cases, the combination of low blood pressure, fluid leak, and airway obstruction can cause rapid cardiovascular collapse and death. The most frequent and also the biggest mistake that we see in the ER is people waiting way too long to use their EpiPen, because epinephrine is the only medication that can stop anaphylaxis. It stabilizes mast cells and reverses almost all the dangerous effects on the various organ systems. And that's why we advise people with known history of anaphylaxis to use their EpiPen as soon as they develop any tingling or itchy throat, vomiting, or any other concerning symptom after a possible exposure. Another really common mistake that we see is when people with a history of anaphylaxis use antihistamines instead of their EpiPen. Antihistamines will help with the itching, the hives, and the flushing, but it won't do anything for the airway swelling, the blood pressure, or the difficulty breathing, because it won't treat the underlying issue of widespread mast cell degranulation. So relying on antihistamines alone is kind of like trying to put out a house fire using a spray bottle. When I saw this patient in the ER, we treated him with epinephrine, antihistamines, IV fluids, and steroids, and he improved really quickly and went home later that night. I'm Dr. Amiri. Come learn more.